Hi, I'm Jessie Gruman, President of the Center for Advancing Health. So here's President Barack Obama speaking to the American Medical Association in June of 2009. The fact is, Americans, and I include myself and Michelle and our kids in this, we do just what you tell us to do. That is what we do. We listen to you and we trust you. Now, this statement, which better describes the state of affairs 50 years ago, clashes with the educated participation in our healthcare that policymakers assume guides our choices today and will protect us tomorrow. It's also inconsistent with survey data showing that 75% of us describe ourselves as fairly active, fairly independent consumers of our care. Nevertheless, the public's response to these reform proposals is consistent with the President's characterization of us. We quickly reject any proposal that seems to change the idealized relationships we imagine we have with our doctors. Indeed, the biggest opposition to reform is that the government will intervene between patients and their physicians. So Obama goes on the road and the airways to reassure us that reform will cause no such thing. Despite our claims of confidence about managing our health care, most of us defer to our physicians on decisions about treatment, placing a high priority on doing what they think best. That's probably why only about 14% of us have ever used quality reports that might raise questions about our doctors or our hospitals or our health plans. And while half of us report that our health care costs have gone up in the past year, 2/3 of us think that our doctors' charges are reasonable. Perhaps this accounts for our reluctance to discuss the costs of care with our physician. Only 2 out of 10 of us have done so in the past 2 years. So much for healthcare consumerism. The lofty rhetoric of both political parties capitalizes on this confusion. Policymakers speak of reforms that portray us as intelligent consumers of healthcare and feed our best vision of ourselves as people who accurately judge the competence of our doctors and the treatments that they recommend, who claim our rights to choose among them and feast on the rich health information online to find the most effective, least costly care for ourselves and our families. But as policymakers return to their districts to discuss reform, their appeals to their constituents are based on fear of losing that comfortably passive relationship with our wise doctors, with those who oppose reform threatening its loss and those who advocate reform assuring us that nothing will change. Neither message is true. Regardless of whether reform is enacted, that kind of relationship, that passive relationship, is increasingly untenable. Our competent, critical participation is already required if we are to find and benefit from safe, decent health care. Meanwhile, most of us wish we didn't have to think about any of this at all. We'd rather go back to the way things were when we just got help from our doctor if we were sick and otherwise went to work, played with the kids, mowed the lawn, walked the dog. Do you know what those physicians at the American Medical Association meeting in June did when the president said we trust them and do what they say? They laughed.